If I'm gonna engage and I'm gonna yell. Wait, no, it moves the red button, right? Yes, that's. No, it can change the color. That guy's just using until beast and the other one. Because the game was. Deliver some groceries.
All right. Hello, everyone. Can you hear me? Let me just make sure my volume's up. Okay. Hi, everyone. I am Danielle Caroli. I am the president of the Progressive Dairy Goat Club, and I just wanted to take a minute to talk about the club, introduce ourselves, and then introduce our speaker for today. We are so excited to be here and have this presentation available to everybody. And we are honored to have Dr. Mary Smith join us today. The Progressive Dairy Goat Club is a club in the Hudson Valley region of New York with members in New York, Connecticut, and Massachusetts. As a club, we work to promote dairy goats in the area and tonight also virtually around the world, actually. I think we have people who have joined us potentially from all over the United States, Australia, Canada as well. So we're thrilled to be able to offer this today. The other big event we offer each year is we have a 2-ring show, the Champagne Classic, which we host in New Paltz, New York at the Ulster County Fairgrounds. This year, our show will be on July 10th, and it will be the host of the Alpine and Oberhausley Specialty Show. Gates actually open on the 9th, which is the Friday, and we will have a youth showmanship class as well. We have RV hookups, and we can accommodate camping with restrooms and shower facilities, and it's a great show. We have a lot of dairy goat camaraderie, and it's a lot of fun. And on Sunday or on Saturday morning, we start popping the bubbly and start showing. So before I introduce our speaker tonight, if you are joining us on Zoom, please make sure your microphones are muted and your camera's off. If we have time at the end, questions can be asked in the chat box or comments section. And if you're having difficulties, just message us on our Facebook page at the Progressive Dairy Goat Club. So now I'm excited to introduce our speaker. We are honored to have her join us and take time from her day to speak with us about dairy goats and dairy goat udder health. Dr. Mary Smith is currently a professor in the Department of Population Medicine and Diagnostic Science at Cornell University in Ithaca, New York. She has been a clinician in the Ambulatory and Production Medicine Clinic at Cornell since graduation from the New York State College of Veterinary Medicine in 1972, and takes veterinary students on her farm calls. Although all large animals are fascinating, her special interests include miscellaneous species, sheep and goats, camelids, gross pathology, and poisonous plants. Dr. Smith has co-authored Goat Medicine with David Sherman, and the 3rd edition is in preparation, and I'm sure we are all excited to get access to that shortly, and is a moderator of the American Association of Small Ruminant Practitioners listserv and the editor of its newsletter. Welcome, Dr. Smith.
Thank you. I'm afraid some of those people in other parts of the world may not be on a normal time schedule if they're really listening in now. So this is a talk that I gave virtually in Canada earlier in the month, which it made it easy for me to agree to speak to you this evening. And it's going to be mostly dairy goat health, but if you have a few meat goats or pet goats on the side, you may find something that pertains to them also. These are some of the things I hope to talk about. When you think udder health, you probably think mastitis. So we'll give a lot of time to that. And in particular, Staph aureus mastitis. Want to go over proper milking procedures. And then because of regulatory issues, I want to cover cytoplasmic particles and somatic cells and the problems they cause when determining your milk quality. Also some antibiotic residue test issues. I'll talk about malformations and diseases affecting the skin of the udder, including some sore mouth and staph abscesses and warts. And then I'll say a little bit about inappropriate lactation syndrome or precocious udder. It plagues pet goats. If you got a dairy goat with this problem, well, breed it and milk it, and it's no longer a problem that it's giving milk. So we'll start with the anatomy of the udder. Despite what your large animal veterinarian may say, the goat has 2 halves, not quarters. And there should only be 1 teat on each half. That seems obvious to you. But if you've seen some Boer goats, they have a lot of abnormal teat structure because they weren't selected for good teats. There is in the udder a gland cistern, a space that's up in this area that fills with milk and holds quite a bit of milk. And then the teat cistern, which has milk here. Again, this is an udder that is producing milk. Now, the little pygmy goat on the left is being milked by a littler pygmy goat. And the one on the right is suitable for you to milk. Hormones during pregnancy cause the development of the udder. And these include progesterone and estrogen and placental lactogen. When you go to milk the goat, or the kid goes to milk the goat, there will be oxytocin released from the pituitary gland, and this causes ejection of milk or milk letdown from little structures up in the udder called alveoli. The milk is made by cells surrounding this little hollow space, and the alveolus has muscles all around its surface, and they contract when oxytocin is given, and will squeeze milk out of the udder. This picture came from a guide to udder health for dairy goats. People from Canada listening in may already know about this, and at the end I'll show you how to get your own copy of it. It's a very good booklet. So mastitis means inflammation of the mammary gland, but that inflammation can be quite variable in severity. It may be clinical, so you can spot it, or subclinical, so it just has some effects like decreasing milk production, but the goat looks and feels okay. The classic signs of inflammation are redness, heat, swelling, pain, and loss of function. And this pertains to your thumb when you slam it in the car door, and to the udder when it gets mastitis, which is usually an infection. The loss of function in inflammation of the udder will be decreased milk production. So depending on how severe the mastitis is, the goat may act sick or it may appear totally normal. The mastitis may be so bad that the udder is permanently damaged, or the goat may even die. And on the other end of the spectrum are those that you didn't even know had mastitis. So when I go to look at a goat that might have mastitis, I'm going to check the udder. But I also will usually start by taking a temperature and a pulse or heart rate and a respiratory rate, and asking the owner about the appetite, because those are all signs of the well-being of the animal. Then I want to feel or palpate the udder, see, is it very firm? Does it have lumps in it? Is it hot? Is it cold? And I want to examine the supramammary lymph nodes. These are lymph nodes at the top of the udder, down below the vulva. And you can, if you reach in deeply, you can feel them in a normal goat, but they can get quite large with draining infection going to that lymph node. And sometimes they abscess, and as in this picture, pus leaks out and down the back of the goat. And that can cause an infection in a kid that is nursing on the teat. I also am going to look at the milk with a strip plate and with a California mastitis test, or you might send samples to a laboratory for a somatic cell count. If mastitis is suspected, a culture could be very useful, and you may be keeping track of the week-by-week production of the animal as an early sign that something, not necessarily mastitis, is going wrong with the goat. So here are 2 goats, and each one has mastitis in the left udder half. The one on the left is chronic mastitis. That half is firm, it's fibrotic, it's not making much milk. The teat cistern is almost empty. There's very little anything coming down from this side. This goat has an acute, just started very recently, mastitis, and that half is large and firm and tender, painful, because there is infection in there. With you can't see the redness because the skin on this udder is dark, but you could feel heat and firmness and pain. So an acute mastitis animal often has a fever. And I just this evening changed my slide from saying 41 degrees Celsius to saying 105.8 Fahrenheit. If you're joining us from some other country that's more rational in its units, this would be 41C. The goat is often off feed, and that half, as I've already mentioned, with inflammation, will be swollen and warm and painful. So in the chronic case, there are abscesses or scar tissue. Usually the goat's no longer ill, though it may be losing weight, just a chronic poor doer. With meat goats, because you don't examine their udder twice a day when you put the machine on, you often find chronic mastitis at the time you're selecting the goat to breed it again. So before you put the buck in with the does, you should make sure that there's a good enough udder there to raise the kids 5 months later. So those udders should be felt to see if something terrible happened during the lactation that the kids didn't tell you about. This is a goat with gangrenous mastitis. And the one half has purple, cold skin. The teat is limp, just flopping down towards the ground because the tissue is basically dead. The goat itself may have a fever or a normal temperature or a below normal temperature. It's going to be off feed, and there often is edema or a pitting swelling of the skin on the udder and on the ventral abdomen going up towards the front legs. That's all caused by toxins from the infection. So here is a vet student milking a goat for the first time, and he sure is squeezing hard. He's lucky the goat hasn't kicked him for his efforts, but he is getting some milk onto the black surface, which is a strip plate, so that I can look at the milk to decide if it is white or bloody. Does it have flakes or clots in it? Is it yellow and serumy? Is there anything looking abnormal? And I often will take a squirt from the other half and compare the milk from the two halves to see if one side has discolored milk in it. This is the paddle for the California mastitis test. It's a very inexpensive test that looks for white blood cells or somatic cells in the milk. The paddle was designed in California for cows. You only use 2 of the cups for your goat, but that's fine. You want to get equal amounts of milk and the purple CMT reagent into each cup, and then swirl the cup to see what happens. Does a gel form? And does the color change? Because the color is an indication of the pH of the milk. And we compare the two sides to look for signs of mastitis. It does not matter which cup the left teat milk goes into and which cup the right, as long as you can remember what you did until you interpret the results. So this is the paddle held on end, and you put in enough milk to reach the outer ring. There are 2 rings in the paddle. This is the outer one, and this is the inner one. So you put milk in both sides, and then you tip it, and milk will run out until you reach the outer ring. Then go horizontal again, or almost horizontal, and add enough reagent to come up to the middle ring and swirl the paddle around. So there was a mastitis researcher who worked with dairy cows way back in the 60s named Sham. And he put in his bovine mastitis book this chart on goat milk, where he looked at the reactions, which in this country are graded 0, trace, 1, 2, and 3. In many countries, the grading is 1, 2, 3, 4, 5, because you cannot do mathematical adding and subtracting and averaging with a trace. So they gave a number to each to see how they could work with the data from the goats. And the number of neutrophils, or white cells, in the milk increases as we go from no reaction to a little bit of slime, to an obvious slime, to a gel that's so thick that it sticks to the bottom of the cup, in the middle of the cup. And that has a huge number of white cells in it. So if you're in Canada, you don't have this problem, but in the United States, we have a legal limit to somatic cells for milk that is sold. And it's 1.5 million somatic cells per milliliter of milk. For cows in the United States, it's 750,000, or half as many. And for cows really in the United States, most of the processors won't take the milk if it's above 400,000, because none of the products can be shipped to Europe if the cell count on the average goes above 400,000. But in goats, we have some leeway, and that's because goats are not cows, and they do things differently. One thing that the goat does differently is in the process of making milk, it has what's called apocrine secretion. And all those little cells that were lining the alveolus up in the udder, they actually pinch off part of the cytoplasm out into the milk when milk is being produced. And those bits of the cytoplasm of the cells are about the same size as white blood cells. And if you count them just as something that goes by a counter in the dark that cannot distinguish a white blood cell from a bit of cytoplasm, you get about double the cell count. And that really gets you into trouble with a regulatory agency. But there are tests that are specific for cells, such as the phosphomatic, which depends on the DNA in the nucleus of the cell. And the California mastitis test is detecting DNA in the nucleus of a cell. But if you're in trouble with the government, then there are special stains that will confirm what is causing the high cell count. Because other cells with nuclei, such as epithelial cells, will increase in late lactation. And the bulk tank in your dairy goat herd may go up over 1.5 million in December without you having a mastitis problem. You now have a somatic cell problem, but not a mastitis problem. And I have one client who many years has to quickly dry off goats so that when the inspector comes back for a second sample, the bulk tank sample is down back below 1.5 million. So this is a slide made from cells from goat milk. And all of these big ones, this is a nucleus, this is cytoplasm, those are epithelial cells. They don't indicate infection. They're normal in goat milk. Whereas these little dark things are probably neutrophils or pus cells. And some of those are normal, but the number will go up with infections. Now, the special stain that can distinguish a cytoplasmic particle, a bit of the epithelial cell from a white blood cell is called pyrimidine Y methyl green. And the white blood cells come out this turquoise color, and the cytoplasmic particles are pink. So very easy to tell them apart, but it's a hard stain to do, and the chemicals are toxic, and it takes a long time, and the government hates it. So this is a graph from an article written by Dr. Paolo Moroni from Italy. He's now at Cornell in our quality milk lab working with dairy cows. But he was studying goats in those days, and the number of somatic cells in goat milk is subjected to a mathematical conversion, a logarithmic transformation, to make it better to average. And every time you increase the somatic cell score by 1, you have doubled the number of cells. So a lactation score of 5 is 400,000 up here, and 6 is 800,000. And as the animals get farther and farther into lactation, more of them go up that high, and the next doubling is 1.6 million, and now you're in trouble. So if we think there may be mastitis, then a culture can be very useful. But if you're going to pay for a culture, you should do it properly so you can believe the results that you get. And these are the steps you'll go through. I'll show you some diagrams later. But dip the teat in a disinfectant. Give the disinfectant time to work. You've got to wait. You can't clean off germs on your boots by running through a boot bath. You've got to stand there a while and let the disinfectant kill the germs. So leave the tip on the teat. Then wipe it off the teat. Take a few squirts of milk out of the teat, because there could be some bacteria at the very end and in the teat canal. We want to know what's up in the udder, not what's at the very end, so squirt that out. Then clean the teat end with alcohol on a little cotton. Discard a couple more squirts, because I don't want to try to culture an alcohol sample. That won't work very well. Refrigerate the sample till it gets to the lab. In the laboratory, the sample will be spread onto a blood agar plate, unless you're looking for a particular organism called mycoplasma, and that takes very special culture efforts. In a large herd, your veterinarian might help you set up your own in-house lab to grow bacteria on blood agar plates. But most of you are going to send this to a diagnostic lab. So here we are getting the sample. Well, actually, it's people in Minnesota, because that's where I store the pictures from. Stole them. Dip it, wipe it, squirt it, clean with alcohol, and take a sample. Notice the person doing the sampling is wearing gloves, disposable gloves, because your hands are covered with bacteria, and the lab's going to work very hard to grow something. And it may be something that was on the end of your thumb instead of in the goat's udder. So wear gloves, clean gloves. These are some of the organisms that the laboratory might grow. Staphylococcus aureus gets the most press time because it tends to make the goat sick, though not always. But non-hemolytic coagulase negative staphylococcal species are very common. In fact, about a third of normal appearing goats have these staph species in their udder. Some of them cause mastitis, others just seem to hang out there. Pseudomonas can be very, very serious, and it often comes from your water supply. Mannheimia can be very serious, and it often comes from the mouth of a kid. It can go from the mouth to the udder, causing mastitis, or from the mouth to the kid's lungs and cause pneumonia. There are other germs around the barn that could be carried by flies or get into a wound. And then there's the mycoplasma I'll keep touching on lightly. I hope you don't have it because we're no good at all at controlling it. So a production decrease might be a sign of mastitis, and you could see it with Staph aureus, with some coagulase negative staph, with some of the other pathogens, certainly with mycoplasma. But you also see production decrease if they got into the grain, or if they came into heat, or it's past time to dry them off. Those are all reasons for the milk production to go down without having mastitis. I'm going to say something about contagious mastitis. Those are infections that spread from goat to goat, usually by the milking process. So milk inside the teacups in the milking machine will then get onto the end of the next goat's teats, get up in the udder, and cause mastitis. There are other organisms that are very common in dairy cows that live in the barn, in the bedding, in the cow manure. But most of us have clean, dry barns because we feed hay, and goats dump half of their hay onto the ground where it becomes good dry bedding. So goats are just by nature a lot cleaner and drier than the dairy goat with its very loose manure. So these are some causes of contagious mastitis that I'm going to go through quickly. CAE, Caprine arthritis encephalitis virus. You have heard of this causing arthritis. 20, 30 years ago, we talked about it a lot as a cause of neurologic disease, but I almost never see the neurologic disease now in goats with CAE. I see arthritis, and I see mastitis. I sometimes see pneumonia. Now, the CAE virus is in the milk and colostrum, and it easily goes to the kid as soon as it nurses. This doesn't happen as often with sheep. They have a closely related virus, ovine progressive pneumonia in this country, Medi Visna in the UK or Canada, and that's not as easily spread in colostrum. So lambs don't get infected as quickly as kids do with CAE. You can also spread the virus with ocular and nasal discharges if they're crowded together, with using needles over again, with using surgical equipment or tattoo pliers without sterilizing in between. Because any place you're transferring blood that has white blood cells in it, or milk that has white blood cells in it, and all milk will have some, then you can spread the virus because it is in white blood cells, not the neutrophils, but the lymphocytes and monocytes in the milk and the blood. So milking machine can very easily spread CAE. What I mean by an impact is when you're milking a goat, if you get a little air into one cup, then because of the vacuum inside, more air rushes in, and it will drive milk up against the teat end on the other teat. And that teat end is open during the milking process. So you can take anything that was inside the liner of the teat cup and drive it up inside the other teat. We have a saying, run, don't walk to the nearest squawk. Because when your teat cups are squawking, you've got air getting in, and that can cause these impacts. And certainly you should not take the teat cups off without shutting off the vacuum first to avoid this. Now, CAE can also be spread when adult goats drink whey or milk. They love the whey from the cheese making process, and it has good nutrients in it. But if you did not pasteurize the milk when you made the cheese, there can be CAE from one goat out of your 50 in that whey. All 50 goats drink it, and they all get infected. Or you may have put a bucket of milk to the side that you were going to take off to feed kids, and a goat coming out of the parlor spots it, runs over and drinks some milk because they still love milk. This is a goat with interstitial mastitis from CAE. Owners often call it a hard udder. That looks like a pretty nice full udder, but if you had your hands on it, you would find out it was very firm and you can get almost no milk out the teat ends. And that can certainly be a sign of CAE. Now, if you kill that goat and look at her udder under a microscope, this is a milk duct that is supposed to carry milk from the alveoli, where it was being made, down to the gland cistern and the teat cistern in your milk bucket. And here is just space now because the milk is washed out, but no sign of infection. All these little purple dots around that canal or duct are white blood cells that are accumulating there because of the CAE infection. And they will eventually get so numerous that they put pressure on the duct and shut it closed so the milk can't get to the outside. Eventually, the udder gets replaced with scar tissue. I don't expect you to know about the histology, but this is not normal udder, and it's never going to make milk again. So the Staphylococcus aureus is a bacterial infection. The CAE was a virus. This is a bacterial infection, and it gets into the udder through the end of the teat, through the sphincter that closes off the end of the teat. It may get in there because the teats have been chewed on by hungry kids. It may get in there because you've got sore mouth on the teat end. Or you can spread it by the milking machine, as I just described, or you can spread it on the milker's hands. Many people have staph on their skin and can spread it to the goat while they're milking. And I'll bet most of you that hand milk don't wear gloves, but it would be good if you did. This is a blood agar plate from the lab, and when the milk gets put on the plate, bacteria colonies grow, and the red is little red blood cells in the agar, and right around the Staph aureus colonies, the red blood cells have been broken down by a toxin from the Staph aureus. This is called being hemolytic, and it's one of the signs that we have Staph aureus. The laboratory is going to report it back to you. You don't have to worry about it. They'll tell you the truth. So how might you get damage done to the teat end? This is a Boer goat, but she is making a lot of milk for 3 fat and sassy kids. And they're all hungry. And they all come in at the same time, and they want to nurse at the same time. And if the one on the left has a teat in its mouth, it's not about to let go. I've seen goat milking in Greece where the goats were restrained not on a milking stand, but by holding their teats. So the owner would catch the goat, hold the left teat and the right teat, one in each hand, and he would squirt out of the left while he was holding on to the goat with the right, and then switch one he's milking and which one he's holding on. That kind of action can certainly damage the teat end, and I hope you're not doing it. But the kids aren't going to give it up just because I said not to. So Staph aureus can be subclinical all the way to gangrenous mastitis. You may have a warm, firm, or painful udder, and the goat may be lame. Why? Because if the udder is painful on the left side, the goat isn't going to want her left leg to hit the part that hurts. So she'll swing it way around to the side, and that will make her look lame as she walks. If the udder is blue and edematous and cold, and the milk looks like the red in the vial in the picture, then you've got gangrene. And that could be Staph aureus, it could be Mannheimia. Occasionally it could be an E. coli. This is a Staph aureus that hasn't gone to gangrene yet, but it's certainly edematous. Not very happy. The goat's pretty sick to just lie there like that. This is my gangrene picture again. So mycoplasmas are septicemic. That means they go in the bloodstream and they can travel to the udder through the blood. They are shed in milk, but they're also shed in urine, in feces, in ocular discharges, in nasal discharges. They get into the ear. And in fact, ear mites, and many of your goats will have some ear mites and scratch at an ear occasionally. A mycoplasma in an ear mite can now walk over to the next goat. A goat kid that's 10 days old usually has ear mites already that it got from its mother if it was raised with adults. And so it's very easy for mycoplasma to spread goat to goat, even if you're not milking it. You do not want this infection. And if you're in a commercial herd, buying from another commercial herd, I would recommend that you get a culture of the bulk tank of the herd you're buying from. You don't want to have to culture every goat in the herd you're buying from. But if the whole tank is negative, then there's less risk that any of the goats have mycoplasma. And if it's positive, do not buy anything, milking or dry, from that herd, because you do not want mycoplasma. Mycoplasmas will often cause a loss of appetite. And one of the kinds is called Mycoplasma agalactia. And agalactia means no, galactia, milk. So they're not giving much milk quite commonly. And when you get that milk into the little sample vial, it separates out into a layer of granular sediment on the bottom and a yellowish, greenish, watery layer on top. And that makes us say, oh, I think I'd better check the box for a mycoplasma culture also. You may first diagnose mycoplasma in your herd because you're noticing pneumonia or septic arthritis in the kids that are drinking the milk raw. There's one kind of mycoplasma called putrefaciens that's putrid. It smells terrible, and the milk has a horrible smell, and we cannot cure mycoplasmas. So there's one case report from California where 700 dairy goats had to be slaughtered because they all got the mycoplasma putrefaciens. And it was the only way to get it out of the herd. Culture each one and kill the ones that were infected. Don't buy this. So how are we going to diagnose mastitis? Those physical exam findings, the California mastitis test, if you see a big difference between the udder halves. So in the picture here, there is a pH difference because the color is different. And if I were to swirl the plate, the C cup would have a gel in it because there's more cells there. So it's not just that she's off feet or in heat. She's got inflammation and mastitis in that side. Send the sample to the lab for them to culture. So how do we treat and control? Well, for Staph aureus and for mycoplasma, the best treatment is called trailermycin. That means you put it on the trailer and you get it off the farm. Cull it to slaughter. Don't sell it to somebody as a pet who's then going to try to breed it and raise kids from it. Cull that goat to slaughter. The sick animal that you're not slaughtering, you may be treating with systemic or intramammary antibiotics and pasteurized milk before it's fed to kids. If you're going to treat, you're going to have to use a bovine mastitis tube because we have none for goats. And when you use a bovine tube, this tube on the bottom was an original design for cows. Cows that weren't being very cooperative, and the dairyman would shove all of that up into the teat so he could hold it in place and squirt the medicine in. This actually stretches and damages the opening to the teat. You don't want to push it in that far. Also carries more germs inside. So the modern mastitis tubes have a partial insertion tip where this little bit comes off, exposing a very short end. And that's all you put into the goat or the cow's teat. before you push in the medicine and rub it around and let it do its thing. There are other ways you can handle mastitis. Both of these goats had surgery. As one way to get rid of the mastitis was to get rid of all of the udder on the left or half of the udder on the right. Obviously, the goat on the left is not going to produce colostrum and it's not going to raise kids in the future. The goat on the right could. Both of these could be bred. And now you've got to do some heavy thinking. Should you be selecting and breeding goats that got so sick with mastitis that you had to do surgery to get rid of the udder? I think the answer is no. That if they got bad mastitis, you don't want to keep their kids. And maybe I think that because my father was a geneticist. And you can solve a lot of problems by culling the mothers and the fathers and the brothers and the sisters and the aunts and the uncles. So don't purchase from a herd that has mastitis problems. Screen the bulk tank. If you're having trouble, culture the colostrum in the milk. Milk the animal last if you're not culling it immediately, so your hands in the milking machine don't spread an infection to the next goat. Use those protocols I talked about. Use the latex or nitrile gloves. And sometimes when you got a staph infection, you might be putting a dry treatment into the udder. If you're going to do that, use a full bovine tube. Even though that was designed for a quarter of a cow udder, you cannot get it clean enough to put half into the other goat udder. So you risk carrying germs into the other half. Use the whole tube. And these are two examples of dry cow medicines. So some more prevention problems. You don't need her. She'd never make it in the show ring. Her udder wraps around her leg when she runs. Not a good candidate for your milking herd. Try to avoid anything that might injure the teat end. The pet goat on the left has a very nice elevated house, but I'm sure when she's in milk, her udder hits the step every time she jumps up into her little house. We don't want horn goats. If you've got registered dairy goats, you know you're not allowed to register them until the horns are gone. You don't want long feet that might step on a teat by accident. When spring finally comes, don't turn the goats suddenly out on a bright sunny day and leave them out all day. Any more than you would let your daughter go out, take her shirt off, and lie on the front lawn and go to sleep there till she gets sunburned. Because sunburned teats are painful to the goat and painful to you as you're trying to milk the goat. So avoid that. Introduce them to bright light gradually. Avoid wounds. That means keeping them out of the brambles, keeping them out of the fences. Keeping them away from the dogs. This poor goat was tethered behind a barn where nobody could see it. 2 German shepherds found it. It only survived because it had the horns. But as you can see, it's got a lot of bite wounds, including one in the udder here that was leaking milk, and we actually had to sew that shut. So control the dogs, or get guard dogs that will control other people's dogs. So this woman hasn't milked very many goats for very long, or she's quite young, because that's an awkward position to be in. But obviously the goat doesn't mind because it's not running away, and she's able to actually get the milk aimed into a very tiny opening in the pop bottle. It's not like those goats in Greece that were being held by one teat, so they didn't get away. But the goat was actually chewing its cud. It was happy. This goat is on a milking stand that would not pass inspection for a commercial dairy, but it does show some good aspects here. One is they've been using individual disposable paper towels for wiping the teats, and that's good. Also, the goat has a dairy clip. So with clippers, the long hair has been removed from the outside and the inside of the thigh and up along the abdomen so that the teats are cleaner, the kids can find them udder easier, we don't get contamination with discharges after kidding running down onto the udder. Everything stays very hygienic if you'll do this once a year before kidding. Teat dipping in an iodine or chlorhexidine product, wiping off the udder, putting on the machines. Notice that this goat has an udder where the teats go in the right direction for milking machines. After milking, you may want to spray or dip with a post-milking teat dip. If you only have a few goats, I would suggest getting the Fight Back product because the container keeps all the rest of your chlorhexidine clean. Whereas if you pour some into a teat cup, into any sort of a cup, you get contamination from the outside of the teat and germs can grow in your teat dip. So that next time you dip a goat with that same sample of teat dip, you could be dipping it in a bacterial culture. So the spray can may be more expensive, but it stays clean. This animal has Staph aureus pustules, little zit-like pustules on the skin of the udder, and also some dermatitis between the halves. There's going to be staph right there at the teat end. So easy for that to get up into the udder and cause staph mastitis. We would be treating this with disinfectant ointments and maybe systemic antibiotics. This goat has sore mouth or ORF on the udder, and all of those scabs, they've been smeared with bag balm, but they still have staph in them because staph gets into skin lesions. This is a goat with very early sore mouth lesions coming from its own kid, just nursing. So we don't have the thick scabs yet, but they're going to develop in this goat's teeth, and that'll make milking her painful and make her susceptible to staph infections, even though sore mouth is a virus. This is a Saanen goat with warts on its udder. We don't see this commonly in New York State because it takes sunshine. And we don't get a lot of sunshine around Ithaca, New York. But in parts of the world with a lot of sun, some farms have actually gone to the effort of selecting for Saanen goats that have pigmented skin on the udder to protect against the action of the sunlight, causing a wart virus to persist and even transform into cancer, into a squamous cell carcinoma. Here's another udder warts caused by a virus. Sometimes they go away, sometimes they don't. And they can make milking a very bloody process as the scabs come off. This goat was fun. I got called for a goat with gangrene. And I rushed over. And this was actually in the days before internet. But the owner knew that the skin turned black with gangrene. The goat wasn't sick. The skin wasn't cold or blue. The goat had freckles because she'd been outside in the sun, and every winter the dark areas would fade away, and every summer she'd get her freckles back again. This is what hungry kids can do if you leave them on the mother and she's not making enough milk. So this is an early lesion, and that is the back of the teat, because the kid nurses from in front. It only has teeth, incisor teeth on the lower jaw, and so those teeth hit on the back side just up near where the teat and the udder attach, and that's going to get painful. And this goat at the end of the lactation has scar tissue that is actually going to constrict down and keep milk from coming from the udder down to the teat, even though there isn't any mastitis, just scar tissue from hungry goats. One of those kids should have been taken off and bottle fed. This goat has witch's milk, and it's a newborn kid with a little bit of milk in its udder. The udder developed because of hormones in the mother during pregnancy. Do not say, ooh, there's milk in there, and squirt some out, because you open up the canal, and now bacteria can travel back up that little bit of milk and cause mastitis. So say, yep, that swelling of the udder, that happens occasionally, it's not a problem. These two goats have problems because they've never been bred. They have a precocious udder or inappropriate lactation syndrome. And if you breed your dolings their first fall and they develop an udder, fine, they're pregnant, you wanted it. They can get an udder with a false pregnancy, but most of the time, when a high producing genetically doling makes an udder, you're very happy for that. But in the non-pregnant pet goat that gets an udder like the one on the left, now that's problematic. So this goat wasn't pregnant, and the owner decided, well, she didn't have any other lactating goats at the time, so she milked this goat every day for milk for her coffee. And that's one way to handle the precocious udder, just milk it. You can also mate the goat and get it pregnant. Some people that have had so much trouble with this in previous goats will ask a veterinarian to take the ovaries or the ovarian uterus out of the goat so the hormones won't be there to encourage mammary gland development. But that's, you people are here for the dairy goat side of things, so you're not going to do that. This is a goat that was not pregnant, and there's no way I can make that udder go away other than surgical removal, which is expensive, by the way. So some abnormalities. This kid has supernumerary or extra teeth. This one and this one. You know which ones are extra? They would not interfere with milking. It's okay to snip those off, the young kid. This is a Boer goat, and they really were not selected for good teeth. And there were goats imported to this country with teeth this bad because nobody looked at the udder. They just said, oh, we got a Boer goat. That's what we wanted. It's a meat goat. So double teeth and fishtail teeth should be culled for meat. Those does, you really want them to have nice teeth that the kids can easily milk. This is a Toggenburg, and the owner thought the goat had an extra teat on one side and snipped it off when the kid was young. But she guessed wrong. And that goat freshened on the 4th of July, and I got a phone call that they couldn't get any milk out of one side of its udder. And that's because the teat had been cut off and the skin healed over, and there's no way you're ever going to milk that side of the udder because this little teat does not connect to that side of the udder. So this was a different goat, and the owner wanted us to cut off one teat so she could get all the milk out of the other side. We put a red dye into one teat here and then milked the two teats from that side. One gives white milk, one gives red milk. It's not gangrene, it was just a dye that was put in there. And obviously, if she wants all the milk, she has to milk both sides. This is a problem you can do something about. It's called a weeping teat. And here at the top of the teat, there's a little milk oozing out of a pore in the skin. And makes your hands wet and slippery when you hand milk the goat. And there can be milk secreting tissue that isn't up in the top of the udder where it belongs, but it's actually in the wall of the teat. And that can go to the outside through a little pore in the skin. I can close that little pore with a silver nitrate stick repeatedly after every milking for a while. This is another weirdo. This goat has mammary gland in her vulva. And so she had 2 teats down there, and she wanted to have 2 extras up here because in the embryo, the mammary line goes from the chest all the way back to the vulva. In this case, some of that embryologic tissue was left behind on each side of the vulva, and she's filled up with milk that you can't remove except with a needle. Takes about 3 months for that swelling to go down. And the first time I saw it, I panicked because I had done a tuberculosis test on the goat 3 days before, and then she kidded, and her udder got big and her vulva got big, and I was worried that she was reacting to the tuberculin test. But it was both sides of her udder. So just something we see. It's fun to take pictures of. Now, this is why you're really in the dairy goat business. You're making something that people can eat or drink or make soap with or lotions or all the good things you can do with goat milk. But there's safety issues with goat milk. I firmly believe that goat milk should be pasteurized. There are way too many germs that can be in the milk of healthy appearing goats. Maybe not yesterday, but today, that can make your customers sick. Maybe you've become immune to most of these because you've been drinking goat milk your whole life, but you sell some to a family that's going to feed it to a baby or someone who's sick. They get sick themselves, and next thing you know, you've got a lawsuit on your hands, or at the very least, you feel terrible because the customer got sick. So some things that can be in goat milk are Q fever, listeria, toxoplasmosis, E. coli, campylobacter, salmonella, all bad things for people. If you pasteurize the milk, they won't be there, except possibly the listeria. Because listeria, it may have been in the milk to begin with, or in a little manure, but it will grow in your refrigerator. And most home refrigerators, if a microbiologist comes by and takes a swab, they can get listeria from the wall of the fridge if you haven't been cleaning it regularly. And you can put a perfectly healthy goat cheese into that fridge, and the cheese will get infected, and the listeria will grow in it. Or you can get your cheese infected in your cheese cave where you're ripening it. Theoretically, if that cheese is aged more than 60 days, these germs will die, but they can get reinfected from listeria. We also worry about antibiotic residues in the milk. You don't want to be eating cheese or drinking milk that has antibiotics in it. Some of the commonly used tests will give false positives. This is one called a Delvo Mini. And commercial goat farms may use this to check to see that there's nothing in their milk. And what happens is there's a germ in there that will grow when you warm up the sample, and it will grow and turn the color because there's a pH change as the bacteria grow. So no growth in the purple tubes, growth, negative sample, no antibiotics in this tube. But goats in late lactation can get a positive test because they got a lot of cells in there that will inhibit the bacterial growth. And you may find yourself arguing with an inspector when you know you haven't given any antibiotics to your goat. So this is the book I promised you, A Guide to Udder Health for Dairy Goats. Paula Menzies was the lead author from Guelph. It's an excellent book for producers and for veterinarians and anybody else working with dairy goats. If you're a veterinarian and belong to the American Association of Small Ruminant Practitioners, you can go to our website. And I would have said you could find that resource, but I checked last night and it has been moved because they redesigned the website and they haven't added all the resources back. But if you go to the IGA, the International Goat Association website, they have a copy that is free to the public. So I would suggest you go there and download it. And if you can't get it there, the Ontario Goat people would be very happy to sell you a copy. Udder Health at ASIP. So that's the end of my talk. Some goats always get things backwards. And notice that the milkers adapted to this goat and are milking her as she stands there. And they adapted to the next goat over by only milking one half of her udder. And they have one cup down on the ground instead of milking. So I don't know if you people have any more time. I've used up my time. I'm going to stop my share. And there are a lot of things in chat that I haven't seen.
All right, I have a few questions if you have time, if that's okay.
Okay.
All right, first of all, thank you so much for this. I think we all really enjoyed it, but going through some questions. The first one I see is preferences of what to use to disinfect items like tattoo pliers. What would you suggest?
I like chlorhexidine or Novel Sand. I'll make a dilute solution of that and let the pliers sit in the solution while I'm getting the next goat ready.
Perfect. And then kind
it's
of
less
going
damaging than the betadine. Don't use Clorox on most of your stuff that's metal because the Clorox will eat up stainless steel.
And then kind of going off of that question on a different aspect of disinfection, are there any benefits in dipping inflations between goats, and what should you use to dip in between if there is?
You have to, I guess I wouldn't do it unless I knew I had a problem because it's going to make the milking routine more difficult. You've got to actually get the disinfectant solution all the way up into the teat cup, which isn't going to work so easily if you just dip it down in because you'll have some airspace there. I haven't read through all of the Udder Health manual. I would refer you to that to see if they recommend times when you might want to do it and what concentration. We don't do it routinely on dairy cow farms.
Okay. And then touching on the CAE with it, somebody wrote, I have recently learned that 90% of CAE positive does will be asymptomatic. Does that mean that 90% will not have the mastitis issue, or are they saying it is asymptomatic because it is subclinical and therefore not an overtly observed symptom? All positive does will have some udder symptoms?
Most positive does will not have udder symptoms. Most of them will show nothing, but they will spread the virus. And we know that there's some genetics involved in whether or not the goat gets symptoms in its joints, in its lungs, in its udder with the CAE virus. But when herds have eradicated CAE by culling goats and pasteurizing colostrum in milk and separating positives from negatives, then the hard udder problem on the farm disappears.
Okay. The next question is, for coag negative staph infections, are dry treatments effective?
Well, staph are not easy to cure, but the coag negatives are so common that if you're having a problem and you're having high cell counts, I would, under the guidance of your veterinarian, suggest you might dry treat, because some of these staph will be removed during the dry period with the antibiotics. It won't get them all, but it will decrease the number of infected goats.
Okay. And a follow-up on that question really quick, do you have a treatment that you recommend or is for that?
Well, I can think of basically 3 in this country. There's a cloxacillin. There are cephalosporins like
I have a million questions.
Spectromast, DC, dry cow. There's quartermaster. I'm a little leery of quartermaster because it's got a lot of streptomycin in it, and that causes in cows a 60-day meat withdrawal issue. And we have no idea what it's going to cause in goats. So I think I would probably stay away from the quartermaster and stick with a cloxacillin or a cephalosporin.
Okay, perfect. Okay, and then here's another one. Besides clinical signs, are there other indicators of when to culture for microplasms?
If everybody's milking fine and none of the goats have changes in their milk, it's not going to cross your mind unless you're checking because you don't want to buy it from somebody else's herd. Usually this first gets identified because the kids have pneumonia after they drink the milk, or the kids have arthritis after they drink the milk. And then you go back and you say, where did that come from? It might be mycoplasma in the milk. And we've got to go back and control that.
Okay, and then I have another one, and I don't know how many more questions you want. Time-wise, we have a few, but
We've gotten up to 51. That's daunting.
what?
It shows us 50. No, never mind. Only
No. That's 51 people. Don't worry. For best udder health, what is the best way to dry off? Gradually or just stop? And then when do you decide to dry treat?
So gradually or just stop is going to depend a little bit on how heavily the goat is milking. If you're milking her twice a day and she's given a half a pound twice a day, I would stop right now, abruptly. If she is still milking 6 pounds twice a day, well, 6 pounds a day, I would double check that she's pregnant and then maybe consider milking her once a day to try to slow it down, taking her grain away, things like that. It's an individual question. The dairy cows are usually dried off abruptly, and they may be milking 50 pounds today. They get a teat sealant in, so bacteria can't get back in. They may get a teat dip that's a sealant. They get put on dry hay or straw, so they don't want to make milk, and they leave the parlor after the last milking, and that's it. You check them again a week later to make sure they didn't get mastitis. And the goats can probably be managed in a similar way. If you've got a commercial dairy and just want to get this done, I would do it abruptly. If you got a pet goat and you're monitoring it carefully, then you could go to once a day milking for a while. And there's some herds that only milk once a day anyway, because they didn't need that much milk.
Okay, and then I have another one. With a precocious udder, what protocol should you practice so that you do not have mastitis when you freshen?
The big question. If she's been bred and she's just making her udder a little early and you know she's pregnant, you want to keep an eye on it that it's symmetrical, that one side isn't hot or swollen, that she's not sick, not running a fever. If there's a big difference in the sides, so one side is bigger than the other, you may want to have your veterinarian get a culture to check to see that she doesn't have mastitis already, because maybe it's not a precocious udder, maybe it is mastitis that she has, which she could get before kidding. If she's never been bred, or she is developing this in the spring without recently kidding, then if it's gotten big enough to be a bother, milk her out completely and consider getting a culture. If it's just a little bit of swelling, keep an eye on it. Every time you open that street canal, you give the bacteria on the outside a chance to get in. So we would rather not milk them if you don't need to, and it's just a little ooh-ah, she's got some milk in there.
All right, I have two more questions. The first, or we'll ask two more questions. The first one is, can you test for somatic cells at home with a good microscope and a hectometer, or where would you recommend sending a culture to?
So the test for the somatic cells at home is approximated by the California mastitis test, which you can do. It doesn't give you an exact number, but you can compare the sides and check it versus where is she in her lactation. DHIA in New York, Dairy Herd Improvement Association, will do somatic cell counts. So you can get the counts done. And if you're shipping milk commercially, your inspector will take a sample and send it to his favorite lab, which may well be in Albany. Cultures, Quality Milk at Cornell will do cultures. And I think the DHIA will probably refer them to the Quality Milk at Cornell. Did that answer your questions?
I believe so, yes. All right, and then we'll just do this last question. What about a cyst in the udder that is not impacting milking, but is visible and shrinks when the dough is dried off? Would you recommend doing a punch biopsy? Could this be genetic?
Okay, if it's not bothering and it's not getting big and it goes away when she's not milking, it's not full of pus. And I would leave it absolutely alone, because every time you go into something like that, you risk getting an infection. If it's a pea-like nodule in the wall of the teat that is interfering with milking, it could be like that weeping teeth scenario. And I sometimes have drained them to the outside with a sterile needle after scrubbing the teat with alcohol to get the milk out of there. But otherwise, it's some milk secreting tissue like in that goat's udder that can't get to the outside. And after she dries off, it stops producing milk and the lump goes away, but it'll come back next year. It could be genetic. It could just be a malformation.
Perfect. All right, I lied. I have one more question. So when do you think your next book is the next edition of Goat Medicine is coming out? And what would be the best way when it is published for everybody to purchase it?
Well, this is a very sore subject with me.
Oh,
Because I saw when I got back from calls today that there's a message from the publishing company wanting to know when they're going to get the rest of it. And I seem to be the person that's farthest behind. So it's not going to be finished for a few months here. And probably not going to get everything through the publisher before June. So it's probably going to be the end of this year before you can get it. I'm sure it will be advertised by somebody. I don't do social media. Somebody will find it's out. Amazon will sell it. The book company will sell it. And yeah, I will not be selling it personally. So you're going to be getting it through commercial channels.
perfect. Well, thank you again, once again. We really appreciate you taking the time to provide us with this really informative and educational lecture. I don't know if you can see the comments, but there is numerous thank yous both here and on the YouTube live stream. So thank you again, Dr.
You're quite welcome. And have a good evening.
You as well. All right, take care, everyone. Thank you.